Before we get started working in our class treatment teams, let me explain a little bit more about them in the real world. Now, if you think back on the Blind Man and the Elephant poem assignment, all of you seem to pick up on the fact that keeping an open mind and working with one another professionally is in clients or patients, whoever you're working with, best interest. It's also in society's best interest, isn't it? You found out that if you thought previously that a psychologist working solo was okay, you were wrong, because in most cases, it should be a team effort. You realize that teamwork in mental health is not only important, it's necessary. And to be honest, from my point of view, it can be absolutely fascinating too. So to get us started on some really productive treatment teamwork in our class, I want you to picture this. You work in a hospital setting or an inpatient psychiatric unit. You've got a psychiatrist managing medications. You've got a psychologist diving into therapy. You have a nurse keeping track of patients' physical health. And you have a social worker coordinating aftercare plans. It's like assembling the Avengers of mental health care, all working together to stabilize and support someone in crisis. Now, you can even think about community mental health centers. These places are really lifelines to underserved populations, so they're important. Here, you might have therapists providing counseling. You might have case managers connecting clients to housing or jobs. You might have a peer support specialist who's been through similar circumstances or challenges and are able to offer unique insights and perspectives that you might not yourself have even thought of. It's a team effort. Again, a team effort to try to help people not just to survive, but also to thrive. That rhymes, huh? Now, if we shift gears a little bit, we could think of schools even. Did you know treatment teams are behind a lot of the support that students receive, like school psychologists, counselors, teachers, special education staff? They all come together to help students with everything from managing anxiety to creating individual education plans, things like that. It's like a support squad trying to make sure students don't fall through the cracks. And then there are substance abuse treatment centers. These teams are really warriors in the battle against addiction. You have addiction counselors, psychiatrists, peer recovery specialists. They too all work together to guide people through detox and therapy and aftercare. And it again is not easy work, but it can be absolutely life-changing if you have a good team. Even veterans affairs and military settings are areas where treatment teams can shine. They tackle big challenges like PTSD and traumatic brain injuries. These teams can help service members and veterans reintegrate into civilian life better than if these folks try to do so alone. So these particular teams are not just providing care, they're also giving back to those who have served. I think that's awesome. We could even think of correctional facilities. They have treatment teams. Here, you can consider forensic psychologists and counselors who work alongside corrections officers to address mental health issues for incarcerated individuals. This is another tough environment, but if there are teams working together in this setting, they can make huge differences in rehabilitation and reintegration. And this benefits not only the inmates, but communities and society as well. And let's not forget integrated care clinics, where physical and mental health services come together under one roof. Now, those in this class who are going to be doing your specialty presentation on health psychology, this is you. So in this circumstance, you might see a primary care physician, primary care doctor, and a psychologist teaming up to tackle issues like maybe anxiety and diabetes all at the same time. Talk about efficiency. That would be it. And even in private practice, psychologists should rely on applicable colleagues or team members to go over cases with them. And this is really to make sure that they're treating their clients with the utmost appropriate care, isn't it? Oh, a couple of other areas that just popped in my head. Residential treatment facilities and crisis response teams. They round out this list pretty well, I think. So residential facilities are like long-term support hubs for people with severe challenges. And crisis teams are those first responders of mental health who step in during emergencies to de-escalate and connect people to care. Speaking of crisis response teams, did you know that Indianapolis was the first city to pilot a groundbreaking program where mental health professionals are deployed alongside police officers during crisis calls? This was a great initiative, and it was designed to not only handle mental health emergencies for our Indianapolis citizens more effectively than police officers can, but also to reduce the risk of escalating situations that could potentially lead to the use of lethal force. Other places all over the country are watching Indianapolis. They're taking notice of this model and that it works exceptionally well. And so they're starting to adopt similar plans. And I just think this is great. So whether it's in a hospital, a school, private practice, in the community, wherever, treatment teams and consults between colleagues should be the backbone of what the mental health care system should be. They bring together the best minds, the best skills, the best support systems to help people live better lives, right? And who wouldn't want to be part of something that impactful? Now, what do you do if you come across a practitioner that's working solo in a mental health capacity, but doesn't seem interested in the input of others about their cases, others who might be able to offer insightful contributions for a patient or client's care? Think back on the blind man and the elephant poem. Remember how important it really is for the client or the patient, and society too, to always seek guidance, no matter how seasoned one might be. Well, this is what you should do. I'm going to share it with you. You want to approach the situation thoughtfully and ethically, of course. So determine why you believe the psychologist needs guidance. For example, is it due to ethical concerns? Is it due to a lack of expertise? Maybe you see signs of burnout. Also, you want to evaluate the risk or the potential impact on this practitioner's client, don't you? Is it that there's a worry of a immediate harm or risk of harm to this person? Or is it more about improving care quality? I'm going to give you 5 steps on how to handle this appropriately. So number 1, you're going to have a professional conversation with this practitioner. You're going to discuss your concerns in a private and respectful manner, but avoid confrontation. You want to make sure that you're solely focusing on the client's well-being. And in doing so, you're going to use I statements This means expressing your perspective without assigning blame, okay? For example, you might say something like, I feel this case might benefit from additional input because of XYZ. And in doing that, you're also going to try to highlight the positives of collaboration, not a critique of their competence. Okay, so that's the first thing you're going to do. Second thing you're going to do is you're going to encourage ethical reflection by this practitioner. So one way to do this is by reminding them of the professional standards that emphasize consultation and collaboration, such as those that are outlined by the APA Ethics Code. Again, you're going to focus on the client's best interest. You're going to emphasize how seeking guidance can enhance their care and support the client. Third thing you're going to do is you're going to document your concern. Document, document, document. Always keep records. Document the specifics of the situation. Include what led you to believe that guidance is needed, as well as your attempts to address the issue. But make sure to stick to just the facts. Always avoid personal judgments, just the facts, okay? Fourth thing you're going to do, you're going to seek support from supervisors or peers. Consulting with a supervisor is important if you think the psychologist's refusal poses a risk to the client. You're going to want to involve a supervisor or somebody in a leadership position about that. You could engage the treatment team that you're involved in, if applicable. Bring up the issue during the team meeting to encourage a collaborative discussion. Okay, number 5, last thing to consider is you could provide ongoing support to this practitioner by maybe offering to collaborate yourself with them if you're qualified, okay? If you're qualified. You could let them know that you're available to discuss the case or brainstorm solutions with them. You could also suggest how or where you've personally found resources like training or peer consultation groups or supervision to address any areas of difficulty that you think that they're having, okay? But if these 5 steps don't work, consider reporting if necessary. Absolutely follow reporting protocols. For example, if the psychologist's refusal to seek guidance results in unethical or harmful practices, this would be a reason to report the issue to their employer or to a licensing board or a professional association. You also want to make sure to protect the confidentiality, both legally and ethically, not only for the client, but the practitioner. This approach balances, I think, respect for the psychologist or the practitioner's autonomy with that need to prioritize ethical care and client safety. And if you find that the situation is more complex or higher risk, maybe consulting with an ethics board or legal counsel might be necessary. So now that you have a good understanding of how treatment teams work in the real world, you'll be able to work in our class treatment teams with more knowledge and skill and make great contributions, I think. I'm really hoping for 2 things out of this exercise for you. 1, that you find them a valuable asset to your future skill and career, even if you personally won't be using them specifically. But most of all, I want you to have fun with them. Okay? Cheers.